someone wanted to know about the ocular effects of digoxin. And digoxin is digitalis. It's derived from foxglove. It's a very old medicine that's been used for a lot of things. In the modern era, it's a cardiac drug. And so as opposed to losing your color vision or not being able to see things, digoxin has a very unusual symptom. It causes chromatopsia. You see color, and you see more color than you're supposed to see. So it's a chromatopsia as opposed to a achromatopsia where you don't see color, or a dyschromatopsia where the color is wrong. It is a chromatopsia because you see some color. And that color is usually yellow, but it can also be blue. So the blue version is cyanopsia, and the yellow version is xanthopsia. And so you can see blue or yellow. And perhaps the best illustration of what that would look like is Vincent van Gogh. So if you've ever seen Vincent van Gogh paintings, like sunflowers, a very prominent painting of his, or irises, it tends to be like either all blue, like Starry, Starry Night, or all yellow, like sunflowers. And some people have even hypothesized that perhaps Vincent van Gogh had ocular digoxin toxicity. So the patients are going to say things look yellow, things look blue. It can also cause loss of visual acuity, though, because it is a toxicity at the level of the retina, and it is leading to the sensation of chromatopsia and cyanopsia. And you really should be thinking about this when the patient has this symptom, everything looks yellow or everything looks blue. That is a very distinctive symptom. It's an unusual symptom for someone who has an optic neuropathy to say things look yellow or things look blue. Usually they say things look gray because they have dyschromatopsia. They are losing color function, not gaining color function. So this is a gain of function problem. And the reason is this digoxin is probably affecting the electrical activity at the cellular level in the photoreceptors. And there's a number of animal models that suggest that it is related to electrolytes, sodium, potassium, ATP pumps at the level of the retina that is producing this. The interesting thing is it doesn't correlate with digoxin levels, so they don't have to actually be dig-toxic systemically. And it doesn't seem to be dose related completely. So some people get it at what would be considered reasonable doses. So it's not like other toxicities where there's some sort of cumulative effect, or it's weight dependent, or it's duration dependent. It's somewhat idiosyncratic. And so really it's a clinical diagnosis. So if the patient is on digoxin and says they have chromatopsia, you should think about a D-challenge, take it away. In order to prove it, you have to have a re-challenge, but most people don't want to be re-challenged. But because digoxin is such an important drug, the re-challenge is sometimes necessary to show that the drug is actually the cause. We're going to check their acuity, their field, their OCT, do all the usual things, but really it's a clinical diagnosis supported by a D-challenge. And because the symptom is so sensitive and specific for the ocular digoxin toxicity, it usually just talking to the person. There's no testing that you do. So digoxin, chromatopsia, Vincent van Gogh.